New Mexico doesn't have a behavioral health system. New Mexico has bits and pieces of a behavioral health system. About a year ago, the governor decided to put 15 provider agencies out of business. We have wrecked what little that we had.
I think the whole Medicaid thing hurt a lot of people. When you lose your caseworker and say you're in a mental health crisis, it takes you a while to trust somebody. My biggest thing, and it's not just in my work, it's in my family, is finding the right facilities and being able to keep a person there and then making sure that they're getting the aftercare.
I'm in recovery, so I have 3.5 years of sobriety. I've also suffered with mental illness. And during that time frame, it was really hard for me to find services that were available. There sometimes is like a 3-month wait to get in. And I mean, if somebody is experiencing a crisis in their life and they're trying to find treatment, to make them wait that long is just, it's ridiculous.
I'd probably say the biggest barrier here in New Mexico is a cultural barrier. Struggling with multiple mental health diagnoses in this kind of cultural environment that's very figure it out on your own and do it yourself, I think that mentality has been the hardest thing to get rid of.
One thing is just trying to find the right person that you can really relate to and them not be so judgmental. You know, me being a trans woman, it's really hard, to find.
One of my friends, we grew up in a shelter together, and now we sit on a youth board together, and he aged out of foster care system, and he's been homeless ever since. And he's living on the streets now. He has schizophrenia. He doesn't have the support enough to help him get out of that.
Mental illness, it's misunderstood. And I think that providing more resources for people who are suffering would make a big difference in our community.
We could actually see New Mexico change and come higher, be a better place, be more economically friendly if we help those with behavioral health.
The idea of a really good behavioral health system from start to finish, at least in my mind, it would definitely be community-based. It would not be privatized in any sort of way. So maybe we're using taxes to fund for this. Maybe people are paying for it personally as like a sort of program.
Adding it into the education system about knowledge of mental health instead of looking at it as a problem, that's where it is. Because kids grow up seeing someone different than them, it's that's weird. You have to interact these youth with different varieties of people.
A lot of youth are struggling with a lot right now. It's important to have a good, comfortable, safe place where kids can go.
There was a time until a few years ago when we had targeted case management as a Medicaid-funded service. There was a time when we had transitional living services and other residential services for people with behavioral health needs that Medicaid would pay for. The first thing that we have to do is restore into our Medicaid state plan all the essential services.